Good morning. My name is Dr. Jane Davies and I'm the Clinical Support Manager for Huntleigh. So today I'm here to talk about a new wound treatment device called the Wound Express. And I have with me Nicky Ivins from the Welsh Wound Innovation Centre. So Nicky's been involved in a clinical evaluation of the Wound Express. So she's here today to provide a clinician and patient perspective of the device. And I'm also joined by Kirsty Mahoney, who's here to ask us some questions today about the Wound Express.
Thank you, Jane. I've just got a few questions to ask you both, if that's okay, about the Wound Express. So the first one is, what is the Wound Express? Can you tell us a little bit about the product?
So the Wound Express is an intermittent pneumatic compression device which can be used as an adjunct to standard compression therapy to treat lower limb wounds. So it consists of a garment which is a bit like a blood pressure cuff, which is applied to the thigh and attached to a pump. So typically a patient will take this device home and use it for about 2 hours a day. Usually patients tend to use it in the evening, so they pop the garment on, set the pump, go in and just use the device in the comfort of their own home while they're watching TV. So I'd like to show you a video of the device to explain how it works. The thigh garment has 3 chambers which inflate up to a pressure of 60 millimeters of mercury. The chambers inflate and deflate as shown here in a special patented timing sequence. This sequence pushes venous blood out of the thigh, which in turn draws venous blood up and away from the wound site in the lower leg. The special sequence of compression prevents venous reflux, which of course is often problematic in patients with leg ulcers. The active pumping of blood out of the venous system causes a drop in venous pressure, and this acts to increase the arterial venous pressure gradient, which subsequently draws arterial blood down into the lower leg and wound site. This improved venous and arterial blood flow helps to heal the ulcer by, for example, increasing the delivery of oxygen and nutrient-rich blood to the wound site.
Thank you, Jane. That gives us a really good overview about the product. So we know that static compression in the form of bandages, hosiery and wraps is the gold standard treatment for venous leg ulcers. So what would be the rationale for the use of Wound Express?
So we know that the NHS manages in the region of 300,000 venous leg ulcers every year, and research has shown that 47% of those don't heal within 12 months despite having gold standard treatment. So I think most of us as nurses can think of patients where we're doing everything that we can, we've optimised wound treatment, we have them in that gold standard compression, but still the wounds fail to progress towards healing. So our clinical evaluations to date have shown that adding the Wound Express in addition to their standard compression just gives legs that bit of extra squeeze that they need to kickstart the healing process. However, I should say that it isn't necessarily so that nurses should wait for 12 months before they actually try the Wound Express. We have evidence to show that the earlier you intervene and add the Wound Express to their treatment, the better the outcome for the patient.
So can you tell me then, what is unique about the device?
Wound Express is unique because it's applied at the thigh, away from the wound, so it's far more acceptable to patients. It's also something that can be used at home, ideally 2 hours a day while the patient is resting. And what we found doing the evaluations, that it's suitable for patients of all ages, so we've included patients in their 20s and more elderly patients in their 80s. I think what's really important is the way that it empowers patients. They are in control of their treatment and they really get involved and feel active that something is being done to them, and in conjunction with the care provided from the normal nurse or practitioner.
So can you give me some examples where Wound Express has been used?
Yes, I can. I'm going to talk about 2 patients who are representative of the cohort of patients that have been part of the evaluation. So the first is a 51-year-old lady who had been under the care of lymphedema since 2014, her edema was being controlled with flat knit hosiery. Unfortunately, she developed red legs and was advised to remove her hosiery, and we know the story. Edema increases and she developed bilateral cellulitis, which led to having multiple lower leg ulcers. At that point, she was advised to wear compression wraps. Her ulcers healed apart from one. So she came to our clinic in September 2019 with an ulcer that had been present for 13 months. It measured 7 centimetres squared in area. The biggest problem was that she couldn't face looking at her wound. So she was seeing the practice nurse 3 times a week. When she came to us, she didn't know what dressing she was having. She couldn't put the wrap on herself. So we spent a lot of time supporting her, and she agreed to take part in the evaluation. She came back 2 weeks later. We'd seen a reduction in pain, we'd seen a reduction in area. So gradually, over that 16-week period, she gained confidence and actually reduced the numbers of times that she saw the practice nurse, and she became active in her treatment. She was changing the compression wrap herself, she was changing the dressing, and of course continuing with the Wound Express. And at week 16, she healed, which was a fantastic ending for this lady who'd come to us. She was so nervous and really anxious to get this wound healed. The second case I'll talk about is a 74-year-old lady who had an ulcer of 5-year duration. She had medical history, hypertension, she suffered with depression, and she'd been going back and forth to the GP with recurrent infection and had actually been admitted twice for IV antibiotics, which had all had limited effect. So when she presented to clinic, she had a wound that was 64 centimetres squared in area, surrounded by chronic inflammation. She'd struggled with compression in the past. So again, we supported her and discussed her taking part in the evaluation. So the agreement was that if she didn't like it, she could stop at any time. 2 weeks later, she came back and already was reporting a reduction in pain. We didn't really see a change in wound at that point. At week 6, we saw reduction in area of the wound, this continued reduction in pain, reduction in edema, reduction in exudate. She continued and she stayed with us for the 16-week period. At week 16, she had reduced in area by over 70%. And what was really interesting, that during that time, she didn't experience one episode of infection. So again, a really positive outcome for that patient.
That's brilliant. So I think those patient journeys, thank you so much for sharing them, are really, really powerful. So I think I'd also like to know, if that's all right, what sort of clinical evidence is there to support the use of Wound Express?
So to date we have 3 research studies which support the Wound Express. So the first is a study by Nicky and colleagues which was published last year. So they undertook a prospective observational pilot study involving 21 patients with hard to heal wounds. So I'd just like to say that when we say hard to heal, these wounds had a mean duration of 45 months prior to being included in this study. So they really had been around for a long time. So participants used the Wound Express for 2 hours a day for an 8-week period in addition to their standard wound care. And what they found was that 95% of patients progressed towards healing and that they had a mean reduction of wound surface area of 43%. And also in keeping with what Nicky was just saying with regards to experiencing a reduction in pain, 83% of patients in this study reported a significant decrease in their pain levels. In addition to that study, there's also been a lab-based study undertaken by Dr. Rhys-Morris, and he examined how the Wound Express affected distal arterial and venous blood flow in 20 healthy volunteers and 14 patients with leg ulcers of various etiologies. And what they found was that when the Wound Express device is in use, so you have a 2-minute cycle of compression and then a 2-minute rest period. And in that rest period, they found that arterial blood flow velocity in the dorsalis pedis artery, so in the foot, was significantly increased. And similarly for venous blood flow as well. And I think what this study shows is that use of the Wound Express results in positive effects on both arterial and venous blood flow, distal to the compression, but proximal to the wound sites. We have a clinical evaluation that's currently ongoing at 6 UK wound centres. So to date, 45 patients have been recruited. And they use the device this time for a 16-week period. So they're given the device to use in their own homes, and they use that in addition to receiving their standard wound care. So to date, 25 patients have completed the 16 weeks, and of those 25 patients, 35% have actually healed completely, and a further 61% have progressed towards healing, with a mean surface area reduction of 57%. And once again, I'd just like to emphasise that these patients were very difficult to heal, and the mean duration was around the 4-year mark. So patients had these ulcers for a very long time.
Thank you. I think that's presented the evidence for when Wound Express can be used quite succinctly. But I think we want to know now, when and where is the product available?
So the product is available now. It's on the market as a rental model, so the pumps are rented and the garments are single patient use, so they are purchased. So I think to summarise the Wound Express, it's a very innovative advanced wound care device. I think the information that Nicky's kindly talked to us about has shown that it's easy to use. Patients perceive it very positively, particularly because they're in control of it. And also, I think, very importantly, the Wound Express has been shown to be clinically effective. In fact, Professor Keith Hardin has actually spoken about the Wound Express, and he's called it a real game changer in the field of leg ulcer treatment. So if you would like to find out any more information about the Wound Express and are at the Wound Care Today conference today in Milton Keynes, please do come and see us and have a chat. We're at stand 46. Or otherwise, you can also find information at www.woundexpress.com. So thank you, Nicky and Kirsty, for taking part in this Facebook Live, and thank you to everyone for watching today. Please keep an eye on the Wound Care Today Facebook page for more live sessions later today.